Welcome to Undercomplicating Stuff, where we, two psychologists and coaches with over 40 years of combined experience, share our insights to help undercomplicate important topics. A friendly reminder that this video is meant for conversational and entertainment purposes only. Please see the information section of this video for additional resources. We have an amazing guest today, Charity O'Reilly, who's going to be helping us undercomplicate this topic. So I'm Dr. Julie Radico. I'm a psychologist, a coach, an author, and a speaker, and I'm here with Stacey Gedian.
Thanks, Julie. I'm Dr. Stacey Gideon. I'm a health psychologist and the founder and CEO of a healthcare consulting and professional coaching business. And Charity, please introduce yourself.
I would love to. Thank you so much, Stacy and Julie, for having me on today. I love talking about trauma and PTSD. I really do. I know it sounds like a strange thing to love, but I love it. So I'm excited to be here and talk to your audience today. So I'm Charity O'Reilly. I'm a licensed professional counselor in the state of Pennsylvania. I also have been a trauma therapist for almost 20 years now. And in that time, I've become an EMDR certified therapist. I'm an IFS, which is internal family systems therapist. I'm a certified trauma-focused cognitive behavioral therapist and also certified in trauma processing yoga. So through my career, I've just kind of gathered all of the various tools and resources that are helpful for healing trauma, and I'm really looking forward to talking about them today. These days, I'm a private practice therapist. I actually provide intensive therapy retreats for people who've experienced trauma. So every other week, somebody new flies in from all around the world, and I work with that one person for about 5 days. We just kind of really settle into their story of their experience of trauma and use all of those amazing modalities that I just mentioned to heal their trauma.
Thank you so much for being here and speaking with us today. Lots of questions we have for you. Starting off with, though, what do you think are some big misconceptions that people have about trauma and PTSD?
Trauma and PTSD are something that really happens sort of at two different extremes. And I'm going to say that over and over, and I'll probably do this hand motion a lot for anyone who is watching. And that actually includes the misconceptions. Because on one hand, we've all seen and noticed the people who might overuse the word trauma. They might say, I went to the grocery store and they didn't have my favorite ice cream, and I was traumatized by that. And I think we could all agree that they were not, in fact, traumatized by that. And maybe it wasn't even a particularly stressful. It's a word, though, that has become used in the lingo to describe something that was really upsetting to someone. So, one misconception is that trauma is just something that happens that upsets us. That's actually not what trauma is at all. But on the other side of things, what I actually see a lot in my practice are people who have experienced very real trauma and who have minimized it and perhaps have spent their life minimizing it. And despite having experienced a lot of trauma and having PTSD symptoms, they actually are not ready to say yet that they have experienced trauma or have PTSD. And so you see this really over exaggeration of what is trauma, and then also this real under exaggeration of what is trauma. And I think, in this day and age that we're living in, people experience trauma in so many different ways, which we'll talk about. But there are things that we collectively even experience that truly are traumatic. And that when people say, for example, living with a war happening is traumatic, that could be. We'll talk about the definition of PTSD, and that could be traumatic for someone. Or when somebody has the experience of racial trauma, and perhaps as a white person doesn't recognize perhaps the kind of trauma that has occurred, but absolutely being a Black person in America or a person of color in America can lead to trauma. And so I think it's really important for us to know what is trauma.
I'm hearing you say that in our everyday conversations, we tend to use the term trauma in ways that might not actually capture what it means or what like a therapist is talking about when they're talking about trauma. How would you encourage people to define it?
So we're going to talk about two things, if that's okay. One is what is trauma, and then the other is what is PTSD? What do we mean when we say that? So to understand that, we need to think about that trauma kind of at its baseline is something that overwhelms our nervous system's typical ability to cope with something in life. And so I often give the example, imagine that you're an airplane, and that airplane has all of its emergency backup systems. And when you fly Fly on an airplane, you really hope to never need any of those emergency backup systems. They tell you about them at the beginning of every flight. They tell you how your seat bottom will turn into a life preserver and how oxygen masks will drop from the ceiling and how you can go down the little slide, which might sound fun, but I'm sure is not actually fun. So you fly all the time thinking, well, I hope that I never need to experience those emergency backup systems. Our trauma responses, which lead to post-traumatic stress disorder, are the emergency backup systems of our nervous system. And when we go through typical life, whether we're having stress in our relationships or stress because we couldn't find our favorite flavor ice cream at the store, hopefully we don't need to deploy any of those emergency backup systems. But sometimes something happens that is so overwhelming to our nervous system that we do, in fact, have to deploy those emergency backup systems. And those become what we know as post-traumatic stress disorder. However, I want to just pause here to name that there's another kind of trauma that can occur as well. And it's a kind of trauma that we think of as leading to something called CPTSD, which is complex post-traumatic stress disorder. And those don't tend to be the single incidents that people often think of as going hand in hand with PTSD, a single moment or an event that overwhelms your nervous system's usual ability to cope so that you have to deploy those emergency backup systems. Instead, CPTSD comes from the slow erosion of trauma over time, often things that we call developmental trauma, the kinds of things that can happen in someone's childhood, even in their infancy, that they aren't having the kinds of experiences that they would need to have to reach different milestones for their nervous system. And so one comparison that trauma therapists often like to make is there's two kinds of trauma. One explodes and one erodes. But over time, both an explosion and an erosion can have the same kind of impact in a person's nervous system, or in that analogy, on a landscape. And so when we're thinking about PTSD or CPTSD, we're really looking at, did something happen that made this person's nervous system have to change? Whether that was one single explosion or whether it was a slow drip over time.
I really like putting it that way, and it really kind of helps to frame exactly what you're talking about. I'm wondering if you could tell us a little bit about the different symptoms. There are so many symptoms. And if someone is wondering, well, maybe I have it, maybe I don't, or a loved one, what are some of the common symptoms that we should look for? And specifically, can you define the difference between having a memory of a difficult experience and then re-experiencing it as it relates to trauma?
I'd be happy to. So this is where I'm going to do this again. If you're someone who's watching and not listening, I'm just showing both of my hands to say that when we think about PTSD symptoms, we do think about them happening on two sort of opposite sides of an extreme. And so on one hand, we have all of the symptoms of PTSD that we classify as re-experiencing symptoms. Flashbacks would be in that category, panic attacks would be in that category, intrusive thoughts would be in that category. That's when their nervous system is trying to process the trauma. It's trying to use its emergency backup system by repeating and rehashing over and over again the experience of trauma. So that could be in their dreams where they're having nightmares. That could be through flashbacks when they're awake. It could be simply in their body, experientially. They're feeling the moment of trauma happening over and over. And so their heart rate increases and blood pressure goes up and they perspire and all of those things are happening. So that's on one end of the spectrum. On the complete opposite other end are the other post-traumatic stress symptoms, and those are the avoidant or dissociative symptoms. And those look the exact opposite of those re-experiencing symptoms. Over in the avoidance and dissociative categories, we have other ways that a person and their nervous system might try to process trauma, which is through avoiding it, even sometimes to the extent of something that we call dissociation. And dissociation is something that actually happens in our brain that you can see in a PET scan or an fMRI, where we detach from that reality. That reality of the trauma, whether it was a moment of explosion or an ongoing erosive drip of trauma, was so overwhelming to the nervous system that your brain completely detached from that. And so when we're talking about trauma responses and PTSD, we're really looking at it happens on both of those ends of the spectrum. And sometimes people experience both of those over and over in the course of a single day. And that can be why PTSD feels very overwhelming to the nervous system and why it can be so difficult to cope with ordinary life when you're swinging back and forth between those two extremes. And other times people live in one or the other of those for the most part. You had asked, though, about the difference between remembering a trauma and actually re-experiencing it. And this is something that there there are lots of assessments that are designed for this. And so I certainly wouldn't want somebody to sort of diagnose themselves in this way. But knowing that if you were to seek out trauma treatment, that trauma therapists use a number of assessments to really look at what is that trauma doing in your nervous system? How are you experiencing it in your body? And often, what those things are about is as simple as, is this a memory that you are thinking about, but you actually feel pretty safe when you're thinking about it? Or is this something that is in the moment right now? You're re-experiencing it in your nervous system and you do not feel safe. Even if this thing happened 20 years ago or 40 years ago, it does not seem safe at all to you. You feel as though you are reliving it in the present moment. But again, there's some pretty thorough assessments that we would look at with somebody before we would diagnose PTSD to see, is this something that they are re-experiencing in the present moment? Their nervous system does not realize yet that that event is over, or is it something that they know is over and they're thinking about from a distance? And that's really a lot of what we're looking at for healing in post-traumatic stress is the person able to notice from a distance that trauma did happen to me and it is not happening right now.
So you're defining really clearly and thoughtfully what the difference between a flashback is versus like a memory. Like, I'm curious, what are some of the things that people tend to get mixed up on, or what maybe some of the myths are about trauma or PTSD, in the fact that like some of the stuff is like feels kind of gray to know where you fall and how to clearly define it.
It really does. Thank you for pointing that out, Julie. And this brings us back to what I referenced earlier, which is the idea of CPTSD. And I think this is a common thing that really confuses people. And honestly, if you start Googling it, you're probably going to get even more confused. And, there's really good reasons why CPTSD is really confusing to people. One of them is it's actually not a recognized DSM diagnosis. And it is in the ICD, the International Classification of Diseases. So most other countries in the world recognize CPTSD as a diagnosable condition. But what happens is that people often don't recognize themselves in the pure PTSD definition. They might recognize themselves in some of those back and forth that I described. Maybe they recognize their flashbacks or their nightmares, or maybe they recognize their avoidance or their dissociation. But when they really just look at the criteria of PTSD, they don't see themselves reflected there. And that's where CPTSD comes in, which is that in addition to those criteria that we talked about for PTSD, CPTSD brings in the relational aspect because typically CPTSD is something that occurs inside of relationships. I mentioned that we often call it developmental trauma. You might also often hear it called attachment trauma. CPTSD are the kinds of experiences that usually come about perhaps in someone's early childhood or perhaps in a relationship that they have with someone who is abusive towards them in some way in adulthood. And because of that, we see that the symptoms end up being very relational as well. So people have difficulty trusting themselves. They have difficulty trusting other people. They have difficulty with their own self-esteem and self-concept. And so a lot of times things like self-harm or disordered eating will come in here. And also people with CPTSD can be misdiagnosed with conditions like borderline personality disorder or other disorders that really are about relationship and how the person is in a relationship, but it's the trauma that is impacting them. And so I think it's so important for people to know that if they don't see themselves and their real symptoms and their real struggles in the typical classic PTSD definition, it might be because it's actually for CPTSD so much more about relationship with yourself and relationship with others. In case you're wondering what I meant a moment ago by self-concept, really what we're thinking about there is that CPTSD, or the experiences of trauma that happen in a prolonged period of time, a prolonged erosion, really wear away at someone's identity and their sense of self. And so, for instance, they might start to believe that they can't trust themselves to make decisions. Perhaps that's happened in the context of someone who has been abusive or neglectful to them and has used that person's words or their beliefs about the victim's identity to make them feel as though they really can't trust themselves. Maybe they start to feel like they can't trust themselves because they did trust themselves to make a decision about a relationship, such as a partner or a person that they wanted to be in a relationship with, and then that person turned out to be abusive to them in some way, perhaps emotionally abusive or mentally abusive. And so over time, it erodes that person's ability to think, I'm a person who can make good decisions for myself. And it also really ties into our body, not just our thoughts about ourselves, but that in our bodies, we learn to not trust what our body body is saying, because perhaps our body has said before, this is somebody that I can trust. I feel good and safe with this person. And then whether that was a parent or a sibling or a caregiver or a partner or spouse, that person began to treat you in an abusive way. And so then it feels like I can't even trust what my body is saying to me. I'd like to share another common myth that we see with trauma, which is that people only get PTSD if they are weak. And that is the furthest thing from the truth. So I described the airplane analogy, and another helpful analogy for thinking about trauma is to think of it as an injury. So we certainly wouldn't say to someone that you only broke your leg because you're weak. We think of our physical bodies as something that can be wounded and can heal, but we often don't think about that with trauma. However, if we think about trauma from the framework of it's a wound to your nervous system, it's something that happens that overwhelms your nervous system's usual ability to cope, not just your nervous system, but would overwhelm, in fact, anyone's nervous system usual ability to cope, just like that airplane up in the sky, if it needs to deploy that slide or those oxygen masks, the airplane didn't do something wrong. It's responding appropriately to an emergency. And it's so important for people who've survived trauma to know your nervous system is responding appropriately to the emergency that has happened. And in fact, anyone's nervous system would respond in a similar way. Maybe it would look different on where it falls on the spectrum. Maybe they would respond maybe over here with more re-experiencing symptoms, and you're responding over here with more dissociative symptoms, or vice versa, or some combination. But it has nothing to do with you being weak or your nervous system not being up to the job. It's responding actually very appropriately to the experience that it's had.
Thank you very much for explaining that. And the analogies I think are super helpful. You mentioned in your introduction a lot of different therapies that you do to help treat trauma. And I'm wondering if you could go into more depth about what has shown to be the effective treatments for trauma, as well as what should people look for to make sure someone's qualified to help them.
What we know in that healing trauma, that there are some things that do not work for healing trauma. And one of those things, and I see this happen all the time, that people come to me and say, I've been trying this for years and years and years and it hasn't helped, is what we kind of generically call talk therapy. And so that's when you're just kind of talking to somebody about your trauma, perhaps, or about your life, but you're not getting any deeper into what's really happening in your brain and in your body. So I love talk therapy. I think talk therapy is really useful and great for so many things. But when we're really looking at the injury to the nervous system, that means we need to get into the nervous system to heal in some way. I have a whole online course about this where I explain the neurobiology of trauma, the parts of the brain that are impacted by trauma, and why we can't just talk about our trauma in order to heal our trauma. But I think it's why so many people will have experienced trauma and then perhaps been in therapy for years, even decades, and say it hasn't made a difference in my trauma because they're just talking about their trauma instead of really getting inside of their nervous system to heal it. So in order to get inside of the nervous system, what does that even mean? Thankfully, there are actually a lot of forms of therapy that do this. So I mentioned some of the ones that I love. I love any kind of brain-based therapy, but the one that I'm trained in is EMDR, eye movement desensitization and reprocessing. However, there are a lot of other great ones out there, such as deep brain reorienting, brain spotting, progressive counting, lots of other kinds of therapies that really get into different parts of your brain, not just the part of your brain that you talk from. So I'm a really big believer in a brain-based therapy like that. Another kind of therapy that people don't typically think of as brain-based is internal family systems therapy, or IFS. That's a limbic brain of therapy. So it really gets into attachment. It gets into the attachments that happen inside of yourself. And then body-based therapies. So I mentioned that I'm trained in trauma-sensitive yoga, so I do love that particular body-based therapy, but there's a lot of other great ones. There's somatic experiencing and sensory motor therapy, all kinds of great body-based therapies that can really help people's bodies heal as part of their nervous system healing from trauma. You'd ask, how can someone know who is the right fit for this? Of course, they might have certain certifications and trainings, and they will usually, of course, have those listed on their website, and you can talk to them about that. That's really important. But I would also say it's so important to notice, do you feel safe with a particular person? And that's going to be different for everybody because everyone's experience of trauma is different. And so some people might only feel safe with a particular gender or a particular age, or not feel safe with another kind of gender or age. Some people might feel safe only with a certain kind of presentation in therapy. perhaps somebody likes somebody who's very warm and soft and compassionate, or perhaps for somebody else that doesn't feel safe to them and they want somebody who's really direct and directive. It's really about how has your nervous system been wounded in particular, and therefore what feels safe to you. So that's, I think, the first important criteria. And because trauma is not a choice that we have, we don't get to choose whether we experience trauma. We only get to choose how do we heal from it. I really encourage people to take advantage of all of their options when they're looking for that. So even as simple as schedule 3 different consultations with 3 different therapists, meet with each of them and see how does my nervous system feel with this person. Give yourself options. Of course, you can ask them about the different brain-based or body-based therapies that I mentioned, and there are many others besides. But the most important criteria of success will be, do I feel safe enough in my body and in my nervous system with this person to be able to go to the really deep places that we have to go to do this work? And you know what? If those first 3 people don't work out, give yourself another 3. Sometimes it can really take a while before you find the person that you feel safe with, that you could do that kind of deep work with.
I'm mindful as you say that it's really important to find somebody that you feel safe with to do any type of therapy, and encourage listeners to really be thoughtful in not slipping into avoidance. If you then turn into like looking at, I've tried 20 different consults with 20 different therapists, and to really take that information that maybe you're just still looking for the right fit, and maybe there was somebody who was pretty okay, and that it's scary to take that next step, but to really support yourself and encourage yourself to do so. On that topic, Charity, what would you encourage people who may not be experiencing PTSD themselves, but they have a loved one, is looking for support with trauma, is looking for a therapist, is currently being seen by somebody, and they just really want to be supportive wherever this person is at in their journey? What would you encourage loved ones to do, and specifically maybe also like not to do or not to say if they have a loved one who is dealing with trauma in some way?
That's such an important question, Julie. And I think one of the most important things that we can do for our loved ones when they share that they're experiencing trauma or PTSD is to believe them. It's really difficult for trauma survivors to find words for their experiences. And this actually goes back to neurobiology because the prefrontal cortex, the part of our brain responsible for language and words, shuts down when we're experiencing trauma. So it can be really hard to find the right words to describe to our loved ones. So therefore, people often don't. And their loved ones think, well, it's probably not that big of a deal, or why do they think that could have caused them trauma? Really, it's a lack of understanding what the person really experienced because that person doesn't have the words to put to the experience. And so if someone says to you, I feel like I've experienced trauma, or I feel like I have PTSD, or I was diagnosed with PTSD, I think just believing them and their experience, just like we can't get inside of somebody's body with an injury. If someone has an injury and they say to you, wow, that is the most painful thing I've ever experienced, we're not inside their body and can't say, no, that's not that bad. Don't say that to somebody who's experienced trauma either. Let's really take their word for it and know that on a really deep level, they might not be able to find the words to describe to you, or perhaps what happened isn't something that they're comfortable describing to you. There are very good reasons why people can't always verbalize and explain the trauma that they're experiencing. There's often a lot of shame as well around trauma and trauma responses. And so many good reasons why people can't explain to their loved ones what they're experiencing and what it feels like. And so for us as the loved one to simply take their word for it and support them where they're
My
at.
key takeaway involves something both you and Julie addressed, and it's finding a professional that you feel comfortable and safe with, but making sure that you're not avoiding getting into treatment because it's something that is really, really difficult and challenging, and we know it can be really scary.
Yeah, I resonate a whole lot with that, Stacey. My key takeaway is something that we say in a lot of our videos. It's just so important and so true. If you're listening to this and it has resonated with you in any type of way that you're like, oh, maybe I have experienced trauma and I've not been able to make space for it yet, or it's been impacting me this way and I maybe need treatment for it, or I think a loved one might be dealing with this. If any of those things have resonated with you, to just be kind to yourself in that we're all on our own journeys, on our own pathways. Be kind to yourself in however this has connected with you and meet yourself where you're at. Be kind to yourself and go forward from now with some of the tools and strategies that Charity has shared with us today of knowing that there are lots of different types of therapies out there, that you don't have to find one specific one that, like, if it doesn't work for you, then there's no hope. There's lots of different approaches out there. So find the one that works for you. And so as we start to wrap up today, Charity, what's a key takeaway that you hope listeners carry with them?
I loved hearing both of your key takeaways, so thank you for sharing them. And my key takeaway would really be, the reason that I love working with trauma and PTSD is because you can heal trauma. It's something that's meant to heal. Your body and brain are meant to heal. And just as post-traumatic stress disorder is very real, so is something called post-traumatic growth, which is where on the other side of trauma, we can actually see increased resiliency, we can see increased compassion for yourself and empathy for others. We can see many strengths emerge on the other side of trauma. I'm a trauma survivor myself, and it is absolutely something that I connect with, that as I've healed from my own trauma, I've been able to offer so much to others in that space. And so I see for myself and my clients and other loved ones all the time that while trauma is very real and very dark, and is PTSD and CPTSD are as well, so is post-traumatic growth. You are meant to heal from trauma. There might be many obstacles that have gotten in your way over the years, but when you find that right support for your body, for your brain, you will be able to heal from trauma.
Thank you for sharing this really helpful information with us today, Charity. We really think that listeners will find this helpful, and we want to direct you all that there will be resources in the description of this video that can help you as you start on this journey. If this topic resonated with you, please share it with somebody that you care about. Also, please comment, like, and subscribe. You can listen to our podcast on YouTube, Spotify, and Apple. You can also message us on YouTube, Facebook, and LinkedIn with suggestions of questions you'd like us to discuss in future episodes.